Hello and welcome to a new episode of Connecting the Dots. My name is Mariana Marques and I'm Azimuth World Foundation Executive Director. The COVID pandemic has brought public health to the forefront of our concerns for the 21st century and show us how justice, politics, economics, education, and every sphere of our lives is inextricably linked to public health. The way Indigenous peoples and local communities were disproportionately affected during the pandemic is a tragic example of this. Their exclusion from strategic decision making and lack of access to healthcare services aggravated pre existing structural inequalities. Now, more than ever, recognizing these inequities in Indigenous health can help us reflect on the broader issues of human rights, sovereignty, sustainability, and the fundamental role Indigenous voices must play in shaping our future. It is equally important to look at Indigenous health from another angle, one that focuses on valuing the wisdom these communities have accumulated over thousands of years about our bodies and how the surrounding environment affects them. Traditional knowledge is now beginning to earn recognition as an essential tool to face our present-day challenges regarding our health, the health of our planet, and the way the two are profoundly connected. There's no one better suited to help us think over these issues than Dr. Nicole Redvers. She's a member of the Anunnaki First Nation, a professor at the Department of Indigenous Health at the University of North Dakota, and a co-founder and chair of the Arctic Indigenous Wellness Foundation. Dr. Redvers is also an internationally recognized researcher and author whose work alongside Indigenous communities worldwide actively contributes to a better future. Dr. Redvers, good morning. Thank you so much for taking the time to talk to us today. I would like to start at the beginning. As a member of the Anunnaki First Nation in the Northwest Territories, when did you first become interested in the field of health, and why did you decide to make it your life's work?
Cho, thank you for the question and thanks for having me here. One of the important contexts, of course, between many of the Indigenous peoples of the world is the similarities, of course, on the overarching element of colonialism, but also the unique geopolitical circumstances that exist within certain countries and within North America, but also, of course, within Aotearoa, New Zealand, and Australia. We had the legacy of boarding schools or residential schools where Indigenous children, including my mother and my grandmother, were forcibly removed from their families to attend schools for the purposes of killing the Indian and saving the child. And as a result of that, many of our First Nations peoples within my region experienced for the first time Western healthcare within those schools. So that was the first exposure to healthcare. And you can imagine, of course, that might not have been the most positive experience within an environment that was full of trauma and full of many complex experiences, including physical, mental, and sexual abuse as well. So that first exposure to healthcare very much permeated the experience, but also the levels of trust that Indigenous peoples within the region see and experience through modern day healthcare. And because of that, we see a lot of our peoples avoiding healthcare until things get very much worse. And then unfortunately, at that point, it becomes very difficult to treat. So I had noticed this when I was growing up within my community, and even later on in terms of young adulthood, the amount of people that were obviously suffering but avoiding healthcare because of the environment of a lack of trustworthiness. And I just kept thinking to myself that, how bad is it that our people would rather suffer at home than go to seek care that's supposed to be welcoming and helping and supportive for people. So that really was a motivation for me to think about going within the health realm and space and figuring out ways for our people to be supported in a way that made sense for them, but in a way that they could trust it and be excited and happy about receiving care from.
Thank you. Dr. Redvers, before we go into your work specifically, it will be indispensable to hear about the living health issues Indigenous communities face today. What are they? And having in mind the incredible diversity that characterizes Indigenous communities, how can we address these cross-cutting issues while still respecting the distinct character of each community?
Yeah, it's an incredibly important point that you bring up, because there's this risk of homogenizing or, bringing together concepts and constructs and issues with Indigenous people without really being mindful of the substantial diversity, the heterogeneity of communities across the globe, not only in terms of their experiences, but also the context of their experiences. Now, having said that, because of the shared history of colonization, because of the shared history of forced removal from lands, because of the history of loss of culture due to modern society ways encroaching or in sometimes forcibly imparting itself on communities, we do see some shared issues across the Indigenous world. And unfortunately, those elements have not been improving substantially over the years. Basic elements, even such as mortality rates, the year of age or life expectancy of Indigenous peoples is substantially lower, not only within low-income countries, but also in middle-income countries and even in high-income countries as well. We see substantial rates of difference, sometimes of things like infectious disease, again, often more prominent within low-income countries, but we also see tuberculosis outbreaks continuing within high-income countries. In fact, right at this moment in the Eastern Arctic portion of Canada, in the community of Pangerton, there is an outbreak of tuberculosis in the community that has been going on for months and months. These are conditions that you would think in these types of situations and countries that would be treatable, which they are, but because of the marginalization and structural inequities of communities, we still see these types of things occurring even within countries in so-called Canada. Lastly, I'll note one of the minimized health concerns that we have within many Indigenous communities across the world is high levels of youth suicide. And that is cross-cutting, unfortunately, due to many complex factors that we have. But it is another one that I think is not often talked about as it should be, because it is a substantial crisis in many communities.
Going back in a very important point that you just mentioned. Recently I read that also officials announced that life expectancy for Native Americans and Alaska Natives fell by 6.5 years, and how these Indigenous communities were nearly 3 times as likely to be hospitalized with COVID and more than twice as likely to die of it. I presume that this announcement didn't surprise you, unfortunately.
No, it did not surprise many of us. It was just another layer on the structural inequities that many of our communities face. But at the same time, too, despite the discussions and the absolute reality of these disparities that exist, the hardships that exist, and frankly, the racism and the discrimination that leads to some of these health inequities within many countries around the globe, there's also many strengths that we also want to balance out and emphasize. And in fact, just noting, as you had stated, within the North American context, American Indians were the leaders in vaccination uptakes for COVID-19 at the beginning of the pandemic. They were leading the way in terms of the percentage of community members who were getting vaccinations due to a strong public health mobilization response that they had, including additional public health measures such as mandating mask wearing, closing off borders, closing casinos. There was a number of things that were done. So despite these inequities, we also saw the balance of a lot of strengths come from these communities, because oftentimes, despite the inequities, they often have solutions. They often have ways of dealing with crisis. They just are not given the opportunity and sometimes the ability, funding, or the flexible structures to allow those solutions to actually come forward and be solved.
Indigenous communities face a lot of barriers to accessing healthcare. But even when healthcare is available, it often, like you already mentioned before, it often fails to be culturally sensitive. So, and I think it will be important, for all of us that are hearing then the podcast. How important is it to understand a community's worldview in order to provide adequate healthcare?
Well, I think even going back to what the definition of healthcare is, healthcare in its current conceptualization and what we often think about is very much within a Western domain or a Western worldview. So even the concept of healthcare and how we think through it is by its very nature through a Western orientation. So because of that, if we root ourselves within that concept that is what healthcare is, then automatically we're in a comparative mode of trying to say, okay, well, how does an Indigenous community's view compared to what is now? When in reality, for true self-determination for Indigenous communities, we should actually be flipping that around, or flipping the question around to say, well, how can Indigenous well-being and Indigenous communities' ways of knowing and healing be encompassing, or how can Western systems actually adapt to that as opposed to the other way around? And really, that is the fundamental issue that we see, is we don't have a lot of systems that are centering Indigenous peoples, centering Indigenous communities, centering Indigenous traditional healing and their knowledges, and then asking, okay, well, how does Western healthcare support that? How, where are the things that are needed and beneficial, and how do we merge it into our systems as opposed to the other way around, where we're often having to force healthcare systems onto our people in a way that doesn't really work. So, that really is the base of thought. And I often like to switch that question around a bit, because it really does change the conversation.
It does. And I was thinking, that, medical research has still fallen short regarding Indigenous communities. And you just touched also a very important point, which is the colonial mindset that still permeates Western research methods. And so, in your opinion, Dr. Redvers, how can we decolonize methodology? And is it the scientific community heading towards a more comprehensive knowledge democracy?
Yeah, well, the idea of knowledge democracy, I think, is fundamental here, because we have not had knowledge democracy in any way, shape, or form, with Western scientific hegemony really being, put across the world, from one end of the pole to the other end of the pole, without much room for conversation, otherwise. And there's been two big movements happening within some institutional settings, especially within global health work. Of course, this decolonizing word has really been, a forefront. We've even seen terminology such as indigenization coming about too, and really some fundamental reflections on institutional systems, but also on peoples, on researchers, and many from Indigenous communities asking, is it possible for a Western institution to decolonize? Is it possible for a Western researcher to decolonize? And many Indigenous peoples will push back on that and say, no, the whole idea, the whole concepts around what it means to decolonize, so to speak, is really a matter of it being a political movement led by Indigenous peoples that focuses on the advancement of Indigenous self-determination. So really, is it Indigenous community members that are seeking to decolonize their own systems? Or, are we talking more about indigenizing Western systems? Because as soon as you indigenize, when you eye something, it means that something wasn't indigenous to start with.
Mm-hmm.
If you have to indigenize it, it means it wasn't indigenous to start with. Whereas from a decolonizing movement, it starts with indigenous. It starts with indigenous. There is no Western component. And then it doesn't mean that you have to reject Western research. It doesn't mean that you reject Western institutions, but the indigenous community, indigenous people choose whether or not they want to accept or adopt certain Western attributes within those institutional settings as a part of self-determination. So those are really two key pieces. And for researchers and institutions to decolonize, so to speak, really means that you're ensuring that indigenous peoples have self-determination to determine their own research ways, institutional ways, healthcare ways, and being supportive and not only supportive, but amplifying the ability for that to occur. So really it's opening up the space to allow decolonization to occur as led by indigenous peoples.
You have contributed immensely to knowledge democracy by helping to co-develop the first Indigenous Health PhD program in North America at University of North Dakota. Tell us about some of the research projects developed under this program and how they demonstrate the importance of creating research programs focused explicitly on Indigenous health.
Mm-hmm. Well, I think one of the most basic yet brilliant statements comes from one of the most cited Indigenous scholars, Linda Tuia Smith, who's a Maori Indigenous woman. And she wrote a lot on decolonizing research. And she very simply said, when Indigenous peoples become the researchers and not merely the researched, the activity of research is transformed, questions are framed differently, priorities are ranked differently, problems are defined differently, and people participate on different terms. Because when you have questions that come from your own worldview, then it's applicable to communities. And one example at the University of North Dakota is with the support of now previous professor at the University of North Dakota, Dr. Donald Warren, but also a number of other researchers and support people within the department received a large chunk of funds from the National Institute of Health to create an Indigenous Trauma and Resiliency Center for research. And one of the funded projects under there was a project that I'm running, which is an Indigenous traditional food project. And what we're looking at is we've constantly had narratives of the trauma, of course, from historical and present day events affecting our communities and the way even that our physiology expresses itself. So I was interested in turning that narrative around and say, okay, well, yes, all of these harms have happened and continue to occur, but how can we actually look at the positive effects physiologically from some of our ceremonial items, from foods, from cultural practices, and being able to showcase the strengths of communities and the ways that our traditional foods are able to heal. So this is the first time that the University of North Dakota has ever run a clinical trial, because funny enough, foods are considered a clinical trial under the National Institutes of Health, which is always a bit funny. But it's the first time also that we've had 100% research participants within such a study that are American Indian. And we thought originally, because everybody always says within the research, it's hard to recruit Indigenous participants because, of the mistrust with research. But what was amazing with this project is that we had and have had so far, despite only being a couple months in, within a very not a huge town. I mean, we're based in Grand Forks, not a huge population there. We've had close to 130 inquiries on our study, and we've almost met our recruitment goals within about a third of the time that we were predicting because of the interest from our communities. When you ask the right questions that are meaningful to them and fit with the needs and the goals of the communities, lo and behold, maybe it's not really about the research. It's about the types of questions and the types of methods and the types of outcomes that we're trying to achieve.
And it just came to my mind also, it's a successful PhD program that you created. Do you think other universities, around the United States and perhaps even in Canada will also implement, also these PhD programs? Do you think that's
And I should just note a clarification that, this program was co-created by
yes.
a group of Indigenous scholars, including Dr. Melanie Naidu. I mentioned Dr. Donald Warren already. There's just been so many amazing people as a part of this program. And, this was the first program in North America, that started in 2020. And, it's kind of sad in some instances to think that it took until 2020 to get the first Indigenous Health PhD program in North America, let alone, in most of the world, considering from a global context. Although we've had Maori health programs and Native Hawaiian programs, the PhD level programs from a global context really have been lacking. And I would hope to see that this is just sort of the leverage point that starts to create more interest, because we in our first year had over 300 inquiries in our program, and we only had originally, we thought about only having 12 spots. We ended up accepting way more students than that because we were just having to turn so many students away, which just goes to show the interest and the need for this topic area. We need more institutions coming on board supporting these types of programs, which means we need more institutions prioritizing the hire of Indigenous scholars, which has not been a priority to date, because you cannot run these types of programs unless you have Indigenous scholars as a part in leading these programs and institutions, in my mind.
You are the co-founder and chair of the Arctic Indigenous Wellness Foundation, through which the Inuit, Dene, and Métis came together to culturally revive traditional healing services and practices. What led to the creation of the HWIF, and what are its most relevant achievements so far? And also, what is the importance of promoting health practices rooted in the land?
Absolutely. Well, the work of the Arctic Indigenous Wellness Foundation really was the evolution and the continuation of work by a Denisované elder by the name of Francois Paulette, in addition to an elders council that had worked in the area for many years. But unfortunately, we're facing many challenges. So myself, as well as Elder Bessa Blondin, who's a Satu elder, and Elder Rassi Nishalak, who's an Inuk elder, originally from Pangerton in what is now Nunavut in Canada, came together to bring the Arctic Indigenous Wellness Foundation forward through a gathering of elders from both the Northwest Territories and Nunavut, which is the northern regions within the Canadian subarctic and Arctic. And it was very clear from those discussions the need from our communities, because of many of the things that we've talked about so far, for our people to have self-determined ways of well-being. And we really wanted to provide a platform where Indigenous peoples finally could speak for ourselves within this region and area, because we don't often have the ability to have leadership. We had a lot of work and a lot of difficulty at the beginning finding funding for such an initiative. It was very challenging, in fact, because many modern day funders require evidence that just doesn't exist in the Western sense for many of our ways of knowing and ways of being. And we really pushed back at funders who were wanting to gain information that was sacred or that was a part of or outside of our traditional protocols of sharing and reporting, because it just didn't make sense with the types of projects that we were running. But we thankfully were able to garner the 2017 Arctic Inspiration Prize, which was a $1 million prize to really start and leverage the work of bringing together what is now our best achievement in my mind, the creation of an urban land-based healing camp, which is a land healing camp, but based in an urban center, which doesn't often happen because we have many unhoused relatives. Many of our Indigenous community members live in urban centers now, but don't have a lot of connection to land bases. So in that urban camp, we have traditional healers, we have traditional counselors, we offer traditional food when we can, and we provide a safe space for those to come and receive support from the many challenges of life that are experienced, no matter their background and no matter where they come from in the North. And it's been now in operation. This is our 5th year, and we're just so happy on the amount of support that we've received from community in that regard, and hopefully for years to come.
Yes, I hope, and I wish the same for the amazing work you're doing. Dr. Redvers, your book, The Science of the Sacred, Bridging Global Indigenous Medicine Systems and Modern Scientific Principles, comes at a time that the Western world is finally starting to recognize Indigenous knowledge as a fundamental tool to address our present-day challenges. What are some of the top ways Indigenous knowledge anticipated contemporary technology? And how can Indigenous values and concepts such as interconnectedness and species equity play a role in shaping our relationship with technology and how we use it to protect our planet?
I think you're absolutely right. There's been this fundamental increase within many different fields, circles, disciplines, governments on Indigenous traditional knowledge. And in some cases, the push is so fast paced right now that a lot of folks within Western spaces are getting so focused on the knowledge piece that they're forgetting about the people. So I always like to highlight that when I have this conversation, because it's really not about Indigenous knowledge. It's really about Indigenous peoples who hold knowledge, but they hold that knowledge only when they hold their land for the most part, and how land rights really comes into the conversation. Because when we talk about Indigenous knowledge and its benefits in various fields, we can't separate that from land rights, because that's where the knowledge comes from that we hold. And be mindful of that in our conversations, and not forgetting about the peoples that hold that knowledge and hold the decisions about whether or not to share that knowledge and when to share that knowledge. So because of that, it creates a complex landscape of differential rights within communities around the globe, and how and what risk of extraction may or may not occur from utilizing that knowledge in a way that benefits the wider world, but may not necessarily benefit the community itself. And we're seeing this more and more with the interest in technologies, where historical patterns of people coming in to extract knowledge from Indigenous peoples to use for wider purpose, but without the collaboration, without the respective intellectual property rights, without respective data sovereignty of those very communities. So it's a very delicate balance of trying to think through scale up of Indigenous solutions, while at the same time protecting the full and fundamental rights of Indigenous communities through these crises that we face. And that's a challenge that many communities are going to face, in a conversation we really haven't had to any great extent in communities, is to what extent do we break traditional protocols and share things that we're not supposed to share because of the state of the crisis that the planet faces? And when do we get to that point, and what are our protocols in that? Because we really haven't faced we faced many things throughout histories, but this one is very unique today. But having said that, there's many communities that are willing to share. And speaking of technology, I just think of Dr. Tyson Yunkaporta, who wrote the book. He's Aboriginal from Australia, and it's Sand Talk, Indigenous Thinking, how Indigenous Thinking can save the world. And he runs a podcast and a lot of discussion around the merging of technology and Indigenous knowledge. And in fact, even into artificial intelligence and how Indigenous knowledge systems impact. So there are a few folks within these spaces that are really bridging the modern world and the traditional world together into these very interesting discussions to figure out, how how do we dance this dance going forward that respects our protocols, but also ensures that we have survivorance as a humanity, but as a planet as a whole. And I think it's going to be the next level of complex conversations that Indigenous nations will be facing over the following even 1 to 5 years.
Dr. Redvers, thank you so much for this fascinating and rich conversation. We covered so many important issues. I just would like to invite you to share some final thoughts.
Yeah, I don't think I have anything else to add at this point in time. I think we covered a lot of good components of need and pressing issues that are facing the community. And thanks for the conversation today. Masi cho.
Thank you.